Good afternoon, everyone. My name is Emma Rogan. I'm a project coordinator with the European MS platform. You're very welcome to our first MS at Work webinar. We are delighted to say there are a large number of you attending. This does mean that we cannot have open mics, and during the presentation, I would kindly ask that you would use the chat function to ask your questions. So we have more than 70 people registered, and it is for this reason that we cannot open the mics. However, you can use the chat function to ask your questions. Graham Halsey is our presenter today. He is an expert in mental health. He has experience working with a large insurer in the UK, specialising in return to work. He has also managed a team of occupational psychologists and therapists and nurses. He is a leader in certified disability management in the UK, and he also leads the NIDMAR programs in the UK. Today, he's going to be speaking to us about return to work, about absence management, about people with chronic illness, staying professionally active, and he will go into a number of different areas. He will speak for approximately 30 minutes. After that, we will in the meantime, if you would ask your questions as Graham is doing his presentation, so I will have a list of those questions at the end that we will be able to address. And if you have any sort of comments or any sort of questions, again, I would like to emphasize the chat option within the GoToWebinar software. Graham, I would like you to now take over from me, and if you would go through your presentation. I know we're all very eager to hear what you have to say. And before we go any further, I would like to thank our sponsors for providing EMSP with funding for projects and for events such as this. We would like to thank Roche, Merck, Novartis, and Biogen. And towards the end, I'll also have a list of people to thank. So Graham, please go ahead with your presentation.
Emma, thank you, and good afternoon, everybody. Good morning from those of us here in the UK. I'd like to initially send greetings from my hometown here in Somerset in the UK. I live around about 150 miles west of London on the coast. It's a beautiful part of the country, so beautiful that a number of film crews use this area. The beach is stunningly attractive with a little bit of a bite to it, and the picture I'm using does show it at its very best. And it kind of relates, I think, to some of the issues that we're saying, that on the front cover it looks lovely, underneath there are issues. This beach shows the Somerset coastline really as a calm, easygoing place. The BBC used it to film an episode of Baywatch, where they were using comedians to replicate the Hollywood actresses. And during the time that they were filming, they forgot that the tidal system here is the second highest tidal system in the world, and the tide went out, and the BBC actually lost 3 vehicles as they sank into the mud. So it kind of has a bit of a bite to it here, and it's useful to remember that some things aren't quite as good as they seem. I want to use the time that I have to look at 2 areas here: the employer's view of absence and the employee's view, and then try and use the last few minutes to pull the 2 things together to see, can we get both areas working together, because both sides have real concerns. And employers, I think, are misunderstood. They have real needs, but we've got to try and understand what their needs are. Is it just a case that they see people being a cost to their service? we can understand that UK does a lot of research, and it shows that there's a high number of days per year where people are absent, and that must kind of act as a reason for employers to be reluctant to take a risk, and particularly for people with unpredictable conditions. 8.5 days per year is a high percentage of time away, and employers then become reluctant to look and start to say, how much more of a risk can we take? And you notice that the larger the employer, the higher the amount of time away. That often goes with the fact, of course, that there is a better remuneration for people to be able to be away and receiving sick pay. That's not, of course, replicated across the world, but it does show what's happening here in the UK. So employers need, I think, to have some sympathy, but I'm not going to go too far down that route because I think they need to make a big change as well. Do employers understand absence? Well, previous work shows that only about 40% of organisations monitor their absence, and public sector may be more likely. They're showing there that the cost of absence was about £500 per person, and if you go into public sector, it's higher. That's maybe because they are more generous with their sick pay, and people can be encouraged to take longer to recover. It could also be argued that they do less to support people, and people then stay away from work longer. So there are arguments on both sides as to whether they're good or bad employers that make that change. With health and well-being, there is such a difficult picture to get a feel for. Most absence is short and self-limiting, the coughs, the colds, the flus. But you guys in particular know that absence can be very difficult to predict. It may not be self-limiting, it may not be of short duration. And long-term absence is some of the hardest of all to manage. And I'd like to point out the bottom point to you, that a lot of people will not reveal the truth of what's really wrong with them when they call in sick. This can be related to mental health, but it can also be related to conditions such as MS, because people are concerned to talk about what's really wrong with them in case it impacts on how the employer then deals with them in the future. Now, in the UK, we have an Equality Act which says that if you disclose and there is an impact then on the employer that says that they need to work with you to do that. But it becomes difficult because sometimes if you disclose that, it may be that the job becomes more difficult to deal with. You may never get the job in the first place. And so we need to be realistic about what's going on here. In terms of longer term absence, well, it's probably no great surprise to see that stress is the big one in the picture. It is separate to mental illness, acute medical conditions, and with that area we are talking of stroke, heart attack, cancer. They will be the long-term conditions because they are life-changing, life-threatening. Musculoskeletal conditions have always been the long-term ones. But what we're seeing emerging now is the graph image on the right-hand side where the recurring conditions come in, and MS is showing in this now. And it's showing as quite a significant impact on long-term illness in the UK market. So maybe we're at a point where we need to change how we deal with things. And this is not a picture of a broken windscreen. It's actually a picture from space of Berlin. Change, I would argue, is a slow process. The Berlin Wall fell 30 years ago this week, and this picture was taken 4 years ago this week. And you will see that on the right-hand side of the picture is East Berlin, and the left-hand side is West Berlin. The lights are still much brighter in the West. Change takes time, and we need to keep working at it. And as in Berlin, which is now a vibrant city, it is still obvious from space that change is slow, and we need to keep on and be persistent. So managing absence in the workplace, maybe we could look at preventing absence. That's a novel approach. Estimates in the UK say that rather than just getting rid of somebody because they are perpetually taking time off sick, we might look to make accommodations. And the economic argument is overwhelming for this to be the right thing to do. The government says that the average cost of accommodation in the UK is £184. That would represent to just over €200. The cost of recruiting somebody into a post and getting them working to a full potential equates to £30,000. Surely the argument is that we work with somebody and provide accommodation to help them stay in their role. We provide them support whilst they're off sick, because people with health conditions will go off sick. But we also provide them with support to return to work. And I'll talk about that a little bit more later. We, as a workplace, offer health promotion. We make sure that we have a safe work environment, and we work with the employees to make sure that they are engaged within the whole process. And in doing that, we start to see that the workplace is working with the workers. And that way we all benefit from it. So whilst somebody is off sick, maybe there are some things that we can do. One thing that the employer can do is track the absence, because early intervention is key. The longer somebody is off sick, the longer they will stay off sick. The British government estimates that if you've been off sick for 6 months, you are 80% more likely to still be off sick in 5 years' time. So it is key that employers and employees engage early on. Stay in touch. And for the employer, keep records, because they need to know what they're doing. And go and see somebody at home. See how things are going. Now, if home's not suitable, meet in a coffee shop, meet in a hotel foyer area, just to stay in touch, because home is a lonely place when you're unwell. The early intervention piece I've mentioned, but it is so important. Look at what assistance is being sought. Sometimes it can be as simple as travel to work outside of rush hour periods so that you can avoid hours in traffic, or your trains aren't so busy, or the buses allow you space to sit down. It can just be that simple. And of course, there is no real cost to the employer for doing that. And there is an argument for sharing and finding more information about the condition, so that there is an understanding of the employer's needs, of what they need to do. And for the person who has the condition, typically something like MS, that you can share your needs with them. And I'll talk about this quite a bit more as we go on. The communication, I think, needs to be timely. Allowing someone to stay at home for 3 or 4 months and then phone up to say, how are you doing, is scary, because it's likely to say to the person who's been sick, we're phoning to say you're fired. Agree what is the best way of talking. Make sure that someone in the workplace is accessible. Be personal. Be supportive, but not intrusive. and make the employee aware of available support, whether it be a case that there is some employee assistance programs, maybe it's a case that there are support people within the workplace, and also see what kind of questions you might have for the employee, because I think it's very important that people who are having the conversations are well armed, and the conversations that are had are not just simply bland and unmeaningless, and also look at what is the best location, because offering someone a location where we look at poor access is not suitable. So it's a simple chart, really. I don't need to talk that through. It's self-explanatory, but it is about looking at issues, finding solutions, and agreement, implementation, review, and start again. So the employers have come out of that with, I think, some actions to do. But how do we keep employees happy? There's a challenge here, because we start with, I think, low expectations and fear. Fear that people with MS have a fear of not being understood. Fear that people will use the opportunity maybe to terminate an employment. And health professionals, how much support is there from this? And we need to break that realm of low expectation. The silence that comes out, making it possible to talk. How often can you actually talk to people about your well-being and your health problems? Can employers and employees and maybe the agencies involved around this talk more about work? I have a cardiac condition, and during my recovery, nobody ever spoke to me about work. And I found that really frustrating, because the condition first came to me as a younger person, and work was very important to me. It was never discussed. And indeed, as reoccurring conditions have happened, it's never been discussed yet. Look at what kind of support and adjustment the person may need, because the job can be done in various ways. Can work be done at home? Can it be done flexibly? Do we have to have somebody in the office 9 till 5? All of those questions can be asked and looked at. Those are the challenges that I think we need to start to do. But the need for continuing fluctuating support. 1 week, it may be very different to the next week, and having a plan in place that allows that to happen is important. That must make a difference. It's not just the workplace, though, where support and adjustments need to go on, and maybe that bigger picture could be considered. And of course, not all disabilities are worn outside. Some are hidden. And in the UK, there is a huge day going on saying we are purple, and it's been all over the news today. And of course, there are hidden disabilities, and we need to look to provide more support for that. I was extremely proud to have managed to get an individual who has profound mental health problems a disabled car parking place at his place of work, just to stop him having to walk through a busy car park, because he couldn't cope with that. It's the first time I've been able to do that, and that happened within the last 3 months. Those changes, I think, are the type of adjustment that we could look at and consider more. And it doesn't just need to be around mental health, although that tends to be the flavour of the month here in the UK. The challenge is to overcome low expectation and fear. That's the thing that we need, in my opinion, to keep working with. If we can allow people to be open about their health condition, without the fear of it wrecking their career. I had a conversation with an individual who said, if I am open about my health condition, I create career suicide. And I'm sure that applies to a lot of people on this call today. But showing people that work can be good and that making accommodation and being flexible can allow for great outcomes and for people to be really successful is there, but we've got to allow it to start to happen. It truly is seeing is believing. And I think the responsibility then comes back for you to be your strongest advocates and be able to feel free to discuss this. But I do understand in some places that's very difficult. It isn't rocket science, but raising awareness and building the confidence is a difficult one, and we've got to start it at some point. I've been using in my work and helping people back to work and in some of the training programs that I've been running, something called a wellness recovery action plan. This is being used across many sectors of return to work and areas where people are just looking for help and support. And it's allowing, I think, a safe environment in which people can talk to their employers, their line managers, maybe their HR, and talk through what it is that they recognize are their symptoms, what support they need, what their job entails, and how they are finding things difficult and the good things that they're finding. Also describing what they see that they want to do in their job. I was actually completing one of these yesterday with a lady who'd had a long-term brain injury, and her condition has impacted significantly on her role. We spent nearly 2 hours completing this with her line manager, and it was a very, very powerful session where we encouraged the line manager also to say, so what have you seen when things are going wrong? What do you identify that's happening? And it was so powerful because the line manager was also saying, but I see that you do this, and the individual, oh, I didn't recognize those points. So it was a sharing of information. It was also a sharing of, I think, care and respect for each other. And it was a very different take on any return to work meetings that you would normally see. Because what this has allowed is that they are going to take a joint responsibility on monitoring how things go. It's a flexible document, and it will allow for, I think, people to work together in the future. It's something I'm very keen to see happen. The system that I use was developed by a clinical psychologist in London, but there are various versions around. And I was talking to Emma this morning, and we'll make this available for people to have a look at in the next few weeks. But it's about developing a wellness toolbox, looking at a maintenance plan. What are your triggers? How do people recognize warning signs? When things move to a crisis point, and then how things look as you start to get together again afterwards. What is the plan to move forward? So it's a very, very proactive tool. And I think it's one that can be seen to be very different and a change to how we've used return to work planning in the past. But looking at the barriers, what are they? I come back to lack of communication, the fear of let's not talk about it, and if we don't do that, things will go away. There is a triple whammy effect of let's ignore each other. So we do that and people stay sick, the workplace then hires somebody else, and you know what, you were ready to come back to work, and well, we've got someone doing your job, so well, heck, we haven't got a job for you. Employers also feel that they maybe lose out because they don't understand what's going on. We want to do something right, but heck, we've gone another path now. The line manager in between, they get pressure from above. They don't quite understand what they're supposed to do to help you, and they are then bound by rigid return to work policies that maybe say you've got to come back to work in 2, 3, or 4 weeks. All of those things can be significant barriers to help someone come back to work. I think if we're looking at supporting a return to work, we need to consider several areas. If there's an occupational health service around, they need to be considering flexible working, maybe the reduced hours, introducing break days so that people can rebuild their strength, the option of working from home where it fits into the business ability to do so, but certainly looking at modifying duties, and if there is a target-led organization, agreeing reducing those targets for a period so that people can safely come back into work. Excuse me. Also then looking at increasing gradually hours and tasks. It's no good to say come back and do light duties, because we'll feel somebody in a workplace sat looking out the window twiddling their thumbs. Yes, they've attended 6, 8, 10, 12 hours a week. What have they achieved? We don't know, and we don't know what they can do. So the introduction of tasks that can be monitored is a really powerful tool. Allow people to shadow others to rebuild their confidence. Have a buddy that they can go to talk about their fears if that's needed. If they're customer facing, maybe let them come back in as a back office member of staff. Assess the workstation regularly, particularly for changing needs like MS. A workstation assessment should be ongoing. It should be at least every year, but equally, if there is a change in your condition, that workstation needs to be reassessed. Also, regular advice and changes around fatigue management, because with those changes, you may be able to cope better for longer. And this monitoring and reviewing, be open and honest about it. It's about dedicated contact, working together, and being able to discuss where your support goes. The support needs to be appropriate, timely, and most importantly, sustainable. It's no good having it for 4 weeks and then people go away and forget it. This is a contract almost for long-term working. I won't bore you with the need for appropriate communication, but so much of return to work and working well is about good communication. And it's about taking away the barriers of work. If we're looking at planning a return to work, let's make sure that the times when you're continuing to have treatment are included. It doesn't come as a surprise for the workplace. Let's make sure that your limitations and restrictions are included in the plan. Again, no surprises. If you have pain clinics or you need to go for further assessments or treatments, it's included. If there's issues with prescriptions or you've got financial problems or counselling that you need to attend, make sure those are on the times or days when you're not due to be in work. Because what we don't want to do is set the expectation of the workplace that you will be there Monday, Wednesday and Friday, and then heck, on Wednesday afternoon, you have other appointments, because that's breaking the trust that we're building with the employer. What I'm trying to say is that we have to take a level and fair-minded approach for both sides. It is about being open and honest. People with long-term health conditions must take the responsibility of being honest with their employer. The employer must then work with you. I'd finally like to say that I found this quote and thought it was just so appropriate to this conversation. That takes me to the half an hour mark, and I think that's me just about finished, Emma. Thank you.
Wonderful. Thank you very much, Graham. I think you've given all of us food for thought. We have had...
Pleasure.
Go ahead, Graham. Graham, we have a couple of questions, if I may ask you those now.
Of course.
So one of the attendees, they're on long-term sick leave and they do some voluntary work, and they're just wondering, should they mention this to their manager, given that they took they did use some of the time when they were on sick leave to produce some presentations for their voluntary work, or is it best not to mention it because it could cause misunderstanding? I was on long-term sick leave, but I was able to do this. Could it cause misunderstanding between them and their employer?
I think it depends very much on the level of trust and understanding that you have. From a personal perspective, I think it would be really good to be able to share, because it's showing that you are looking at developing an understanding of the situation, and that could be argued very strongly that what that's doing is you're almost future-proofing your understanding and working towards a more sustainable approach. So whatever's happened in the past, people, when you're off sick, you can't be expected to be wrapped in cotton wool and just lay in bed. And I think particularly doing research into what's going on around can really only be seen to be a very positive effect of management of your condition. I think it's wise to dip your toe into the water, to be careful with each organization, because it does vary so much across organization. But generally my take would be that it's an extremely positive and will be a healthy thing to go forward, because organizations do want that information and want to help understand.
And I suppose it goes back to what I was hearing during your presentation was the importance of communication.
Yes.
And in this case, it's really how this person would communicate that message to their employer. So it's how they would deliver the message about the activities that they were doing.
And I guess, could it be said that I've done this piece of work? Do you have to say when you did it?
Yeah. Okay. Thank you for that. And you did touch on a wide range of issues for people with MS, for employers, I suppose for people who are supporting people in the workplace with chronic health conditions. Please, I would encourage people to use the chat function to ask your questions now. We have a number of minutes to deal with them. Some of the other questions that we have had people sent in before was about with MS symptoms, because they are not visible. Do you think it's possible? This person asked this question before this webinar, and you did speak about the RAP tool, let's say. Would you see that as a way to create a brand new tool, a different system that allows people with MS or other chronic conditions to deal with these issues in the workplace? Is that what you see RAP as being?
Yes, I do. The RAP tool, and if I can sort of use my experience from yesterday as a classic example, this young lady had a significant acquired brain injury, and was making a really, really remarkably good progress. but she does have times where, to her thoughts, her symptoms are completely invisible. And we were talking about how she was feeling, because things like white noise, bright light, brought on extreme fatigue, brought on headache, and brought on muscle pain. Not dissimilar, possibly, to some of the symptoms that somebody with MS may experience. And she was saying, but nobody will see that. That's just me. And my release is to go home. Her line manager said, but I do spot when these things are becoming bad, because you show other signs and other symptoms, including sort of small things for her, like agitation, and you start to scratch, it was a silly thing, scratch behind your ear. Now, that was the pain complex thing. What we were able to do was look and say, so we can come up with something, because they had a quiet room where she could go and take herself away from the white noise and things. It works very well, because it was leading to really good conversation to say they are hidden, but with a safe, and I kind of led the conversation. So it wasn't a threatening piece. It enabled people with absolutely what she believed to be completely hidden, but it turned out that other people were noticing things, and it allowed them to interpret what those traits were leading to. And it gave us a solution as well, which was brilliant. And the RAP tool guides you through those sort of 7 or 8 key points, and I think it's a very, very powerful way forward.
It does sound, from what you've described, it sounds like a very, very useful tool, and not only for people with a chronic illness or with a health issue, but certainly for the general workforce.
I think it could be widened much, much further. Yeah.
Yeah. It's just so practical, and it isn't in the workplace. It's not only about health. It's perhaps people have family members who are ill, elderly family members, or children, or there's something going on. So there are always lots of different issues within the workforce. Graham, I have some other questions for you.
Okay.
If you can't go back to your job and there are no other roles that are suitable, what are the next steps? Do you hand in your notice? Or what? I know this is a big question, but this is something we have. One of the participants in this is actually hosting a group event. The webinar is a group event, and they're having people over to their home. So we have a number of different, an audience in one place in the UK. So, and I know that this question is from there. But what are the next steps? Do people hand in their notice?
Okay. You mentioned at the outset that I do some work with a disability management training thing, and there is a sort of hierarchy of return to work within their planning. So obviously the best thing to do is, well, maybe it's the best thing, is to go back to work, to your employed role. But maybe that's not the best thing. Maybe it is a case of that's the employer that's not giving you what you need. And it could be that continuing to stay there is just going to cause you more and more problem. So the next stage down on that hierarchy, and it does kind of resemble a little bit of Maslow's hierarchy of need, this sort of format. We could look at, can you look at other employers? Now, there are many more employers around who are prepared to take people with disability, but I've got to fully accept that that's easier said than done. I'm now older, I have a disability, and I think getting work would be tough. So self-employment is the third option. And that gives you, I think, an option that people may be scared of considering, but it does give you another role to look at, and it does give you a freedom as long as you can get the financial security around it. That would be my other thing. There's a big issue these days about the gig economy, where people just move from one job to another, just picking up pay for doing one piece of work and another, and that represents, I think, the self-employment market quite well. But it is a case that if you can go back to your employed role, because I think the one thing that I should mention there is it depends on the benefits that you're getting in your employed role. You need to be careful of what you're giving up, because you may never be able to replicate that.
Okay, thank you for that. Thank you for answering that question. We've had a number of questions. They are around the interview process. We have someone who's still in university. We've had a question from someone else about the interview. Should you mention at the interview that you have MS or another chronic illness? Or yeah, sums up the question.
You know, I'd love to be able to say yes, because I think that's the right answer. I think it's going to depend where you live, because I think in some countries it may not be the right answer to give. A lot of employers will offer interviews for people with MS. If you meet the criteria, the Equality Act in the UK will definitely come on to your side if you have the relevant skills. There is support for accommodations to be made through access to work to enable that. I can really only give an informed opinion from the UK, but I was recently at an international conference in Canada, and they were talking much the same language, that it is better if you can to disclose, because employers will feel more able to accommodate. But I totally accept that there are some countries where you may not even get an interview on the back of the disclosure. So I guess it's going to depend on your local knowledge of that. It's also worth looking at where you're applying. What is their policy on equality? What is their policy on looking at diversity? And just go through their websites and read that and see what it says, because you'll get a much better feel for what's happening within that company then.
So a difficult one to answer. It's always a very difficult one to answer. I do think that people are called for an interview because they have the skills and the abilities, and that's why they're at the interview. So it from what you're saying, it very much depends on the individual.
I think it does. I would. I think the point about look at what the company does, I think it's about then your confidence to say, I have this, and talk about, this is how my condition is showing itself now. Because, the other thing is none of us can predict what tomorrow holds. So we don't need to look too far into the future of predicting where we're going. And so I think, where I am now is as far as they need to really know. So what your accommodation needs are now would be good enough.
Okay, thank you. We have another question. It's someone who's congratulations to this person. They are returning to work after a long time being out of work.
Brilliant.
It's absolutely fantastic, and they've got a job in the civil service, and their new employers have asked what reasonable accommodations they'll require, and they're unsure because their symptoms have changed significantly since last being in work. So, is this a case? Is this a prime example of where something like RAP would be useful for this person?
I think it is. If that person wants to contact me separately, I'm really happy to try and help.
Wonderful. I can do that. We can connect you. Yeah.
Because with changing needs from where they were, I kind of look at each return to work case and say, so what are the barriers now, rather than what is the condition? Because I think it's important to say, what is it that we need to change in the workplace? And if the employer is looking for that piece of help, then it shouldn't be too complicated.
Brilliant. Okay. Thank you. I'll connect you two afterwards.
That would be brilliant. Thank you.
We have this is an interesting, they're all interesting questions. This is one that sort of extends beyond the person with the condition, and some issues in the workplace come from colleagues who have to, or who think they have to pull the weight of the person on leave, and it perhaps causes internal difficulties and perhaps resentment. What about employees that don't want their colleagues to know about their health condition, and how should we deal with colleagues who are perhaps affronted by our health condition? Do you have any suggestions?
That's a really, really good point, and I think it's a really difficult point to deal with. I do feel somewhere along the line, somebody needs to know. Because if something goes wrong, or we need to have some help at some point, it's wise that somebody knows. But it doesn't need to be colleagues. It could be HR. It could just be that it's passed through, so that maybe it's on the record, so that your HR file has that recorded. But it comes down to a personal choice on here. You don't have to do this. I personally believe it's useful, but I completely respect somebody who says, I don't want to tell that. And in that case, you've got to run with that. But equally, the issue then comes if the employer doesn't make change, or starts to use other routes of management of absence, then it's a difficult one for them too. And that's why I try to advocate some kind of record of the condition, because the employer needs to know what they're dealing with. And so even if it's a note on an HR file, that changes the dynamic a little bit, but it doesn't need to be shared amongst the whole team. You don't need to have spotlights, balloons and flags on your desk or your workstation to say, I've got MS. You really don't.
And it is your prerogative to not disclose to your colleagues.
It is, absolutely. Your colleagues, it's nothing to do with your colleagues.
It's nothing to do with your colleagues. We just have maybe 4 or 5 minutes, Graham, left before we need to wrap up. If you wouldn't mind, I'll quickly run through a few last questions.
Okay.
What would you suggest for if you don't have a very good relationship with your manager? How are you, say you don't get on with them, but you
go to HR.
Go to HR. Okay.
Go to HR or
you have to find another ally within the company.
Yes.
Also, somebody has had a report done by an external company, and their fatigue, they have multiple sclerosis, has been described as a stamina issue, and they're not happy with this report because it doesn't reflect what's true. How do you think they should take it further?
Yes, without doubt.
Okay.
If the external report is not reflecting their condition, then either use consultant reports that they have to challenge that, or just say it's not reflective of my condition, and try and get the company to look at it in a different way. It depends on what they were getting the report for, would be my one rider there. Just
they have been on they've been on sick leave. So I believe it was to do with that. Perhaps I could connect you with this person.
Yeah,
I'm
please.
very
I'm happy to
conscious.
talk that
Yeah.
through. Yeah.
Um, so we are going to finish up. I just want to thank Graham Halsey. I want to thank everybody. We had a fantastic number of people participate. We were over 70 people taking part at one point during the webinar. So thank you all for giving over your time and for participating and for asking your questions. This session has been recorded, and we will be sharing it in a very short while. People have asked for Graham's presentation. We'll talk about that, and we'll make available all the tools that we can make available. The wrap will be made available in a number of weeks. We'll be working with Graham on that. If you have any other questions, please send them to me. My email address is emma.rogan@emsp.org. You can also contact EMSP through Twitter or on Facebook. If this is an issue that is important to the whole MS community in terms of financial security, for lots of other things that Graham has touched on. We are running another webinar in December with Yolanda Higueras about the mental health aspect of work and the importance of that. Graham, do you have any final comments that you'd like to share with us before you go? Thank you so much for your time.
It's been an absolute pleasure. I've really enjoyed it. I think it's a case that we're looking at a changing dynamic in the workplace, and I think where we can try to engage people, try to engage your line manager if possible, or HR, or a buddy, and make them aware of what's happening in your world, because getting them on your side will be enormously powerful and help you so much. And that would be my thing. Take some control and take away their fear.
Wonderful. And you have, for this is, you specialize in return to work, and perhaps return to work hasn't extended across all of Europe, the whole idea of it. Do you see the shift? You spoke earlier about a shift. Do you see that shift coming all across Europe, or is it only in little pockets? And how do we advance that?
It remains in small pockets, although very interestingly, Belgium only 4 years ago were really not looking at this. Their social security trends encouraged people to remain off work. They're now working dramatically towards a return to work model. And I believe Poland are starting to make moves towards that way. So I think the move is starting to happen. Germany is a key player here, where they are driving through their government some change. But as I said, change is so slow. We've got to keep this message moving. The biggest thing that I've seen happen is the change that the United Nations is now taking up the cudgel, if you like, for return to work and the importance of work. And they are now managing and pulling together under one umbrella all of the previously separate rehabilitation and return to work organizations under the one house. That, I think, will make a difference, and in Europe particularly.
So if the UN is doing it, we can all do a little bit in our own
It would be nice to see the UN do
world.
it for themselves too.
Yes, absolutely. And you've given us a lot of information, and you've also given us some really useful tools that we can implement in our own lives for people with health conditions, but also for those of us working in this area, for those of us in business. We can take a look at our processes, what's going on with HR, and see if we are truly doing the best for our staff and for our bottom line. As you say, it costs maybe €200 to support somebody to stay in work with reasonable accommodation, but it costs upward of €30,000 to recruit somebody. So the money is important. Thank you, everyone. we could keep talking about this, but we can't. We've only 5 minutes, so I'm going to finish up here. Please send me your messages, send me your questions on email or any other way you choose through EMSP. I would like to thank again Graham Halsey. I would like to thank the EMSP Secretariat, Jill Matte, our Managing Director, Elizabeth Casillingham, who's here. I would like to thank all of our different member societies who have been able to attend, and all the attendees. Thank you so much for your time. It is really valuable for us to see how much you value this kind of webinar. So thank you all very much.